Are you taking a GLP-1 medicine like semaglutide or a related medicine such as tirzepatide and finding that your digestion has slowed right down? You're not alone, and there are practical ways to manage it. Constipation is one of the most commonly reported side effects of these medicines. That includes semaglutide, liraglutide, dulaglutide, and tirzepatide, which, worth noting, is technically a dual GLP-1 receptor agonist rather than a pure GLP-1 medicine, though it works in a similar way. How common is constipation? It varies depending on the specific medicine and the dose. With some products, it affects up to 1 in 10 people, and with others, particularly at higher doses or during dose increases, it can affect more than 1 in 10. So if this is something you're dealing with, you're in good company. But why does it happen? These medicines mimic a natural gut hormone called GLP-1. One of the ways they do that is by slowing down gastric emptying, meaning food moves through your digestive system more slowly than usual, and that effect doesn't stop at the stomach. It slows transit through the entire gut. When waste moves through your intestines more slowly, your body absorbs more water from it along the way. The result? Harder, drier stools that are more difficult to pass. So what can you actually do about it? Start with diet and hydration. Aiming for around 30 grams of dietary fiber a day can make a real difference. Think whole grains, vegetables, fruit, beans, and pulses. But fiber only works well when you're drinking enough fluid throughout the day. Without adequate hydration, adding more fiber can actually make things worse, so keep that water intake up. Regular physical activity also supports gut motility. Even gentle movement like walking can help keep things moving. It's also worth trying to establish a consistent toilet routine. Going at the same time each day, ideally after a meal, can help your body settle into a rhythm. If lifestyle changes aren't enough on their own, speak to your doctor or pharmacist about laxatives. Osmotic laxatives, such as Macrogol, are often recommended as a first option when diet and hydration haven't done the trick. Stimulant laxatives are generally better suited to short-term use, so it's worth getting guidance on what's right for you rather than just grabbing whatever's on the shelf. If constipation is significantly affecting your quality of life, it's also worth talking to your prescriber. They may want to review your dose, and in fact, if gut symptoms are troublesome, they might pause or delay a dose increase until things settle. If you experience side effects, you can report them through the MHRA Yellow Card scheme. Your pharmacist can help you with that. Now, there are some symptoms that mean you should seek urgent medical advice rather than waiting. Contact a healthcare professional promptly if you have severe abdominal pain, if you're unable to pass stools or wind at all, if you notice any rectal bleeding, if you're vomiting persistently, or if you have any concern about a possible bowel obstruction. These are not symptoms to manage at home. So to recap, these medicines slow gut transit, which can lead to harder stools and constipation. First-line management focuses on fiber, hydration, movement, and a regular toilet routine. If those measures aren't enough, speak to a healthcare professional about whether a laxative like Macrogol might help. And always seek urgent advice if you develop severe symptoms. Nothing in this video is a substitute for personalized medical advice. Please speak to your doctor or pharmacist about your own situation before making any changes. If you found this helpful, leave a comment below, especially if there's another topic you'd like us to cover. Give this video a like if it was useful, and subscribe to the Bolt Pharmacy channel for more evidence-based health content.